introduction of the participants, ladies and gentlemen, we now turn to the first formal address of the morning. It is my privilege to invite the Federal Secretary Health to deliver the welcome remarks. Over to you, sir.
Bismillahirrahmanirrahim. Honorable Federal Minister for Health, Advisor to Finance Minister, representative from the Economic Affairs Division and Planning Commission, Population Council members, development partners, ladies and gentlemen, Assalamu alaikum. On behalf of the Ministry of National Health Services, Regulation and Coordination, I thank you all for gracing the meeting with your presence. Your willingness to participate in this important national dialogue speaks volumes about your commitment to the future of Pakistan. Ladies and gentlemen, today's gathering is unique and significant. Around this table, we have representatives from the Ministry of Finance, Economic Affairs Division, Planning Commission of Pakistan, and our most valued development partners, including the United Nations Population Fund, UNFPA, the World Bank, the World Health Organization, Asian Development Bank, Gavi, the Population Council, and the Foreign, Commonwealth and Development Office, FCDO, of the United Kingdom. This diverse and distinguished assembly reflects a simple truth that population stabilization is not the responsibility of a single ministry or a single sector. It is a national cause that demands a whole of government and whole of society approach. Honorable guests, the reason we have convened this meeting is neither ceremonial nor symbolic. It is a response to a pressing national challenge. The pressure of this rapid population growth are already visible across our society, including high rates of child stunting and wasting, widespread anemia among women, millions of out-of-school children, and a health system under constant strain. In view of these challenges, the Ministry of National Health Services, Regulation and Coordination, with the support of the Ministry of Finance, has prepared a draft document titled as National Population Stabilization Program 2026 to 2035. It sets out ambitious but achievable national targets for 2030 and 2035. And we request all the participants to review, critique, enrich, and strengthen the draft before it is finalized. I would like to express my deepest gratitude to the Honorable Federal Minister for Health, Sri Mustafa Kamal, for his leadership and unwavering personal commitment to this national priority. His presence today underscores the importance this government attaches to population stabilization. I also thank the Ministry of Finance for their continued and invaluable collaboration in preparing this draft document. I extend my sincere gratitude to all the distinguished guests for their presence, expertise, and commitment to Pakistan's future. I look forward to a productive, candid, and action-oriented consultation. Thank you very much.
Thank you very much, sir, for your comprehensive and forward-looking remarks. You have very rightly underscored that population stabilization is not merely a health sector target, but a national development imperative. Distinguished guests, we are now privileged to hear from the highest political leadership of our health sector, the Federal Minister for Health, Rishi. Thank you very much, sir. Now, I will request from Mr. Adnan Pasha, Advisor to Finance Minister, that you should proceed for his presentation or the remarks. And after that, Honorable Minister will. Yes.
Yes, Honorable Sir, thank you very much for inviting me. Thank you, sir. This is a very important kickoff, as the Honorable Secretary just mentioned. It will have long-term impact for Pakistan, and we're very grateful that all the stakeholders, could attend. Naturally, there will be a flow of activities after this. So what I'll do is, if you could kindly put up my. I'll just have a brief presentation, and all you need to do is just full screen guide comes in. I don't know if you can see this, but I'm going to go very quickly through this, and I'll keep this in English for the audience. We have people from countries that don't speak Urdu, but soon they will. inshallah. So I request the audiences please follow the slides as I will briefly outline to you the data analytics that are crucial for people to understand. It is again not a repeat of the what and the why, but why it's important from a finance perspective. I have colleagues from EAD who will read with you all the time. I have colleagues here and good presence from planning, who are coordinating with the provinces and yourselves and supporting, this very important exercise for the Line Ministry, which is the responsible for the staffs. But this is going to be a busy week, as you know, and the Finance Minister, he'll be presenting the budget very soon, inshallah, on the forthcoming fiscal year. But that's a one-year budget, right? And please do not misquote this, it's very important. It will have, inshallah, positive implications for many. But today, as we start, this journey on design thinking, what we need to collectively do to manage the population metrics, that will have even more profound implications on the budgets for the next 5 to 10 years. And we need to do it right for that. And that's why we need your, collaboration and support in designing. It's a design thinking exercise that will start off here. So Pakistan stands at 258 million. Now this is the sources I've quoted, so you can use this information. 241 is a figure that we had in the population projection report that was presented, I think, 3 or 4 weeks ago by the Planning Commission, supported by the UNFPA and NIPS. So very grateful for that. So I've taken information from that, so we have a baseline to start off with. Pakistan stands at 258 million today, heading for 390 potentially by 2050 as a baseline scenario. The best case being 370 odd million. Now that's 132 million more people in 24 years, the next 24 years, at a 2.55% annual growth rate. R&I I'm showing there as 2.1. And the most honorable Prime Minister himself has called it alarming. This program will exist to change that population trajectory. And it is being launched by the Honorable Federal Minister for Health and Population, who has been championing and campaigning actually for the cause for the last 2 years, and we are aware of that. And the Finance Minister is fully supporting him to this endeavor. And we all expect, all of us should be supporting this national cause. Moving on, next slide please. There's a lot of stuff here. I'm just going to summarize this, why population matters. Again, I've quoted what we've taken from the projections. Any revised National Action Plan without credible numbers is going to be theatre. So let's avoid that now. The projections made are the evidentiary foundation, and they demand an urgent policy response. That means enabling evidence-based decision-making touching key nodes and domains related to population, health, primary education, jobs, infrastructure requirements for all of that, and the water, food, energy security domains that are required to cope, with this nation's basic requirements going forward. Moving on. You can share this, Dr. Saiba, if you want with the audience later on. Again, this is based on the report. The stars you see there are reflecting, are against the numbers that were reflected for the three scenarios. So UNDESA, very grateful to them, Population Council, NIPS, all converge on this. Pakistan approaches between 371 to 397 million by 2050. The gap between scenarios isn't big. It's the direct result of choices made or not made in this room and the sessions to follow. The three stars I've already mentioned, and these are scenarios. Moving on. Baseline, we say for this exercise, 390 million. Business as usual, nothing is changing. Best case, 372 million, 18 million fewer people, but only with accelerated investment. Every year of inaction locks in approximately 5.5, 6 million additional births above the replacement level. Next. By 2050, Pakistan has the population equivalent to 2 Bangladeshs. I mentioned Bhutan, but I'm just making it more drastic here. We will have the same landmass, inshallah, but growing food requirements from the same number of rivers that provide us waters. Every province, grows at 56 to 58%, as you see there. Islamabad, which is my home city, is going to triple. I don't know what's going to be like for us here, but these are realities that are being projected. So how do we cope with it with a wider angle? And that's why population, which is being championed here, is so important for us. So the current resource allocation formula means provinces with unchecked growth are rewarded. A structural perversity we cannot ignore any longer. Next, please. The demographic shifts are modeled on the baseline scenario. Working age population rises 89%, but dividend only if the economy grows at 6 to 8% per annum. And you only have 2 blips of that if you look back in our history. Twice. So let's be realistic and let's address the cause. 100 million youth, that's a generational asset or a fiscal liability. And that's why finance is talking about it. And jobs will decide that, which way we're going. The elderly population triples to 22.6 million. Remember that pensions and elderly care infrastructure does not exist to match that. The Honorable Minister always says that, we're dealing with sick care, not health care. And that means a lot if you listen to it very carefully, not just hear what he's saying. How will we provide family planning services at scale and proportionally for women of reproductive age? That's a question to be answered through relevant work streams. Next. A lot of data here, I'm going to summarize that. Life expectancy improves, but remains comparatively low for a lower middle income country. Infant mortality in Balochistan will still be at the crisis level in 2050 without targeted interventions. And 163% surge in the over 65 population is coming, with no policy architecture in place to absorb that. Moving on. Already mentioned what happens in Islamabad. We don't have the infrastructure to cope with the triple population already. KP hemorrhaging, you see there, 123,000 persons per year, reflecting perhaps economic marginalization, driving structural out-migration. Critical warning here that I'm saying is if international migration channels tighten. They tighten, every domestic projection here is an underestimate. Next, please. Now, this is about fiscal sustainability. Again, I'm going to summarize this, you can take it away. These numbers are real, they're unambiguous, and that's why we are talking about it. Population is the primary driver of collective resource allocation. How we do work with EAD to get MDBs involved, there's a country partnership framework which we should be utilizing, and invite the private sector to help us abate the looming crisis against defined outcomes that are measurable and they then gradually are visible. over the next 10 years under the country partnership framework. Next, please. I hope you can read this, but here I'm just going to summarize some of this. The key areas that we need to end up funding at the provincial level, which will, we are all wary of, but we must. The rising elderly cohort will shift disease burden towards non-communicable diseases requiring reorientation of health infrastructure. Infant and under 5 mortality rates remain stubbornly high. Significant unfinished business in maternal and child health care will require targeted funding. Women of reproductive age, that's nearly doubling, as we said. Without expanding family planning services, fertility decline will lag all scenarios. The health system per capita capacity will erode. Without proportional investment, current health expenditure is around 1.2%. I think that's around what it is wholly inadequate, to actually scale. On education is all interrelated, right? Because that child that's stunted, Nadia mentioned stunting, when that child goes to school, imagine what we're producing. What sort of jobs would that child get? School age cohort, 24% increase. This requires around 24 million additional school places. The youth, which is a cohort of 5 to 24-year-olds, that rises. That's unsustained pressure on tertiary and education structure, and we don't have enough of that. And it's not designed in that way at the moment. So that's another work stream being looked at. And it's important we mention that because it all comes back to population. Gender disparity in education is a compounding risk. Low female enrollment directly sustains ITFR, creating a feedback loop that requires additional funding. We must address all of this and more. Funding can come, but projects need to be aligned, implemented, regularly measured, and course corrected to ensure that outcomes are decided to move Pakistan away from the baseline scenario, 390 million, more towards the base case scenario, which is 370. So just a gap of 18 million, but it means a lot. It's a mindset change. Next. Now here starts my strategic concerns. Non-traditional national security domains are underpinned by population dynamics. They're underpinned by this. So when you talk about national security, this is national security. Pakistan is already classified as water stressed. Population growth, even to the best case scenario, will push per capita availability below 500 cubic meters. That's absolute scarcity in 5 to 6 years by 2030s. Our groundwater use is already unsustainable, and a continuation of the current population growth and migration trends could nearly double extraction by 2050. Irrigated agriculture accounts for around 90% of freshwater use. Food demand growth will require a near doubling of food output. By 2050, urban population may reach around 50%, maybe higher. Again, when you do the spatial, you will have to start recognizing where we really are on that trend. That rising urban food demand will strain supply chains and require agriculture's productivity transformation, not just expansion. Climate change compounds the challenge. Glacial melts, waterfall variability, and heat stress all on crops will further strain the water-food nexus. And remember that the more the people, the more the energy requirement. And that's what I'm talking about next. The heat map spreads and deepens, which is, for residentials, because people are going to live. You're not going to stop this, but it's going to happen. 62% increase implies proportional baseline load growth. And our circular debt gets impacted by that as well. We have a shortfall already unresolved at 258 million. At 390 million, system stress is existential without transformative investment. I can go on, but that's why we're concerned, because I see the debt burden increasing exponentially per capita. We fail to taper the trajectory of population growth. Just to end on this, 370 by 2050 is locked in as the best case as per the projections. Maybe 390. The only question is where in that strange policy faces Pakistan. Slow versus rapid decline is 18 million people and perhaps 50 to 20 billion dollars in entirely, you know, avoidable costs. That's what it is. Higher, it could be lower. That's not what I'm debating here. We need to what we need a simple and non-negotiable, time-bound, outcomes-linked plan with agreed 2030 and 2035 targets on CPR, TFR, and R&I, jointly owned by every province and the federation. DG Population will take over from here, but the work, and they'll work with you on reviewing and aligning the how part of the National Population Stabilization Plan, the NAP, for the next 2 years, being launched by the Honorable Minister. And I thank you all for the attention. I look forward to seeing constructive dialogue and a collective action as one team for Pakistan. Ladies and gentlemen, what we start today here is an echo in eternity for Pakistan and the generations to come. In terms of the well-being of our people and the prosperity of this nation. So that's all from me. Pakistan, Hamesha Zindabad.
Thank you very much, Adnan Pasha, for your very valuable insight and regarding the population and connecting this with our economic development. And I think all the components Pasha Saab has covered, like how health is going to impact, how increased population with the energy sector, with the opportunities, how youth, and so ultimately, goal is what is the next, how we can manage, how we can go solution of this very important, problem. And the solution which we have prepared in consultation with the Ministry of Finance, that is Population Stabilization Program or 10-year program. And today, I just want to apprise the forum that right now I'm going to give you a brief what is inside the document. Already document is placed in your folders. And after that, after the remarks of the minister, we have a detailed consultation on this draft. We really want that all the development partners as well as the technical team should review it, and definitely we will consider your input, and it will be incorporated in the draft issue, and that should be presented to the Honorable Minister, and then after that multiple steps for approval and the provincial consultation, because you all are aware that in the world scenario, provinces are the implementing partner, and without their concurrence, it seems very difficult to go ahead. So just display my presentation.
मुझे पता है कि दुश्वारी हो रही है आप लोगों को कहते हैं थोड़ा सा कॉर्नर्स पे हो जाए, दोनों एंड पे कॉर्नर्स हो जाए ताकि आपको बार बार डिस्टर्बेंस ना हो। जज़ाकल्लाह है थोड़ा सा और कॉर्नर हो जाए। इस टेबल के पीछे चले जाएंगे तो आपको आसानी हो जाएगी। इस टेबल के पीछे चले जाएंगे तो आपको काफी रूम है उस तरफ। यस, थैंक यू वेरी मच। आपको बार बार जहमत हो रही है, बहुत मामला है। थैंक यू वेरी मच। आपका होना भी बहुत जरूरी है और आपको सब कुछ चलाना भी बहुत जरूरी है। जज़ाकल्लाह। नाउ सेट, आप किसी को कोई प्रॉब्लम होगी नहीं। थैंक यू।
Thank you very much. So actually the National Population Stabilization Program is not a policy document. Basically, we have prepared this document as a strategic roadmap that will shape Pakistan's demographic future. And you all know that it comes at a critical juncture when population is already, I have briefed in my earlier speech that we are going to add 6.7 billion people. So there's a dire need that we should focus on this issue. And through this document, I will go very quickly background. You all know that how the increased population is going to affect the education system, housing, employment, food security, water resources, environment, and sustainability. And beside this, if on this as usual, ultimately there will be reaching 390 million by 2050. Recently, we have got this figure from our population projections. And therefore, population stabilization has emerged as a critical national development priority linked directly to economic growth, poverty reduction, and achievement of the sustainable development goals. Next. So, in this slide, I just want to share that after devolution, what the ministry has done, a lot of documentation, a lot of, policy documentations are there, and this is the high time that we should implement the documents which we have prepared, especially the National Population Stabilization Program 26 to 35. Considering that for the financing, we really need the support from the donors, although we will also try our best for the domestic resource mobilization, but agenda or the program or the costing will be so huge, then definitely we need the development partner support. So in this slide, I have just mentioned that what we have achieved so far, our commitment as with FP 2030 and initially with the FP 2020 and then community engagement global established again Supreme Court soon was taken on the alarming population growth rate and here this is also a turning point CCI approved recommendations to manage alarming population growth because in the devolved scenario these recommendations are